Welcome to our comprehensive medical image quiz. In this video, we'll guide you through a series of essential medical tools, devices, and procedures, all illustrated with clear images. Whether you're a student, a healthcare professional, or just curious about medical equipment, this video will help you sharpen your identification skills. Each scene will present a new image, followed by a discussion of its features, uses, and significance in clinical practice. Let's begin our journey into the world of medical instruments and procedures, starting with airway management devices. Our first image focuses on airway management. Here you see an endotracheal ET tube, a crucial device used to secure the airway in patients who need respiratory support. ET tubes are inserted through the mouth or nose into the trachea, ensuring that oxygen can reach the lungs effectively. They are commonly used during surgeries and emergency situations, and for patients who cannot breathe on their own. The ET tube is easily recognizable by its clear, flexible tubing and the presence of measurement markings along its length. Understanding its appearance and function is vital for anyone involved in acute care. Next, let's look at the ortrocheal airway, another device used to maintain an open airway. This airway is inserted through the mouth and is often used in emergency settings or during anesthesia. Its design helps prevent the tongue from obstructing the airway, making it easier for air to pass into the lungs. Recognizing the ortrocheal airway is important, as it is a common tool in both pre-hospital and hospital environments. Notice its curved shape and the flanges that rest outside the mouth, which help keep it securely in place. Here we see two types of oropharyngeal airways, the William airway and the Gettle airway. Both are designed to keep the airway open by preventing the tongue from falling back. The William airway has a unique design with a channel for suctioning, while the Gettle airway is more commonly used and features a simple, curved plastic structure. These devices are essential in emergency medicine and anesthesia, and knowing their differences can help you choose the right tool for the situation. Let's take a closer look at the Gettle airway. This device is widely used due to its simplicity and effectiveness. It is made of plastic and comes in various sizes to fit different patients. The Gettle airway is inserted into the mouth following the curve of the tongue and helps maintain a clear passage for air. Its color-coded bite block makes it easy to identify the correct size quickly. This tool is a staple in emergency kits and operating rooms. This image shows a suction catheter, a device commonly used to remove secretions from the airway. Suctioning is a critical procedure in both emergency and routine care, helping to keep the airway clear and prevent aspiration. The catheter is connected to a suction machine, and its flexible tubing allows it to reach deep into the airway. Proper use of a suction catheter can make a significant difference in patient outcomes, especially for those with compromised respiratory function. Here we see a colostomy bag and a uro bag. These are essential for patients who need assistance with waste elimination. The colostomy bag collects waste from the colon through a surgically created opening, while the uro bag is used to collect urine, often from a catheterized patient. Both devices are designed for hygiene and patient comfort, featuring secure seals and easy-to-empty designs. Recognizing these bags is important for anyone involved in patient care. Let's look closer at the uro bag. This device is attached to a urinary catheter and collects urine from patients who are unable to void naturally. The bag is typically hung beside the bed and features measurement markings to monitor output. Proper handling and regular emptying of the uro bag are crucial to prevent infection and ensure patient comfort. Its transparent design allows for easy observation of urine color and volume. This image features a laryngoscope, a tool used to visualize the larynx and facilitate intubation. The laryngoscope consists of a handle and a blade, which is inserted into the mouth to lift the tongue and allow a clear view of the vocal cords. It is a vital instrument in anesthesia and emergency medicine. The otoscope, on the other hand, is used to examine the ear canal and eardrum. Both tools are essential for airway and ear assessment. Here's a closer look at the laryngoscope. The blade comes in various shapes and sizes, such as the Macintosh and Miller blades, to accommodate different patient anatomies. The light source at the tip of the blade helps illuminate the airway, making intubation safer and more effective. Mastery of the laryngoscope is a key skill for anyone involved in airway management, especially in critical care settings. Otoscope is an indispensable tool for examining the ear canal and tympanic membrane. It features a light and a magnifying lens, allowing healthcare providers to detect infections, blockages, or injuries. Otoscopes are commonly used in both primary care and emergency settings. Recognizing its design and knowing how to use it properly are important for accurate diagnosis and patient comfort. This image shows Magel's forceps and artery forceps, both of which are essential in surgical and emergency procedures. Magel's forceps are angled and used to guide tubes into the airway or esophagus, while artery forceps are straight or curved and used to clamp blood vessels. Recognizing the differences between these forceps is important for selecting the right instrument during procedures. Let's examine the forceps more closely. The Magel's forceps are uniquely angled to facilitate the placement of endotracheal tubes, nasogastric tubes, or other devices. Artery forceps, on the other hand, are designed for clamping and holding blood vessels or tissues during surgery. Their locking mechanism ensures a firm grip, which is crucial for controlling bleeding and maintaining a clear surgical field. Here we see surgical forceps in action. These instruments are vital for grasping, holding, and manipulating tissues during various procedures. Their precise design allows for delicate handling, minimizing tissue trauma. Whether used in minor procedures or major surgeries, forceps are a staple in every surgical toolkit. Scene features different types of endotracheal tubes, including the standard ET tube and specialized variants like the CASS tube. Each type has unique features tailored for specific clinical needs. For example, the CASS tube includes an additional suction port to help remove secretions above the cuff, reducing the risk of ventilator-associated pneumonia. Recognizing these variants is important for providing optimal airway management. Here's a closer look at the CASS tube. This specialized endotracheal tube is designed with an extra suction channel to help clear secretions from above the cuff. This feature is particularly useful in intensive care settings, where patients are at higher risk for airway complications. The CASS tube's design helps reduce the incidence of ventilator-associated infections and improves patient outcomes. This image shows a laryngeal mask airway, or LMA. The LMA is an alternative to the endotracheal tube for airway management, especially in situations where intubation is difficult. It sits above the vocal cords and provides a secure airway for ventilation. LMAs are commonly used in anesthesia and emergency medicine, and their ease of insertion makes them a valuable tool in many settings. Here we see the setup for enema administration, a procedure used to introduce fluid into the rectum and colon. Enemas are performed for various reasons, including bowel cleansing, medication delivery, or relief of constipation. The equipment typically includes a bag or container, tubing, and a nozzle. Proper technique and equipment selection are essential for patient safety and comfort during this procedure. This close-up image further illustrates the enema procedure. The tubing and nozzle are designed for gentle insertion, and the fluid bag is hung above the patient to allow gravity to facilitate the flow. Understanding the setup and proper technique is crucial for effective and safe enema administration, minimizing discomfort and preventing complications. This image demonstrates the head tilt chin lift maneuver, a basic but vital technique for opening the airway in unconscious patients. By tilting the head back and lifting the chin, the tongue is moved away from the back of the throat, allowing air to pass freely. This maneuver is a cornerstone of basic life support and is taught in all first aid and CPR courses. Continuing with airway maneuvers, this image shows another view of the head tilt chin lift technique. Mastery of these basic skills is essential for anyone involved in emergency care, as they can make the difference between life and death in critical situations. Practice and familiarity with these maneuvers ensure quick and effective action when needed. This image demonstrates the jaw thrust maneuver, another technique for opening the airway, especially useful in patients with suspected cervical spine injuries. By pushing the lower jaw forward, the airway is opened without moving the neck. This maneuver is often used in trauma settings and is an important skill for emergency responders. This image features a urometer, a device used to accurately measure urine output in patients. The urometer is often used in critical care settings where precise monitoring of fluid balance is essential. Its design includes a graduated chamber for measurement and a larger collection bag. Proper use of the urometer helps guide fluid management and detect early signs of kidney dysfunction. This scene introduces different types of traction used in orthopedic care, such as Gallo traction, Smith traction, Russell's traction, and Buck's traction. These devices are used to align and stabilize fractures, reduce pain, and promote healing. Each type of traction has specific indications and setup requirements, making it important to recognize their differences in applications. Here we see traction devices applied to a patient's limb. The setup includes weights, pulleys, and supports to maintain proper alignment and immobilization. Traction is a key component of orthopedic management, especially in cases of complex fractures or dislocations. Understanding the setup and monitoring for complications are essential for safe and effective care. This close-up image provides a detailed view of the traction setup. The weights and pulleys are carefully calibrated to provide the right amount of force, ensuring proper bone alignment without causing additional injury. Regular assessment and adjustment are necessary to maintain effectiveness and prevent complications such as pressure sores or nerve damage. Here, we see additional views of traction devices in use. These images highlight the importance of proper positioning and support to achieve the desired therapeutic effect. Traction remains a fundamental technique in orthopedic care, and familiarity with its application is essential for healthcare providers working in this field. This final example of traction devices shows the versatility and adaptability of these systems. Whether used for upper or lower limb fractures, traction plays a crucial role in patient recovery. Regular monitoring and adjustment are key to ensuring optimal outcomes and minimizing risks. This image features a tuning fork and a surgical blade. The tuning fork is used in neurological and hearing assessments, while the surgical blade is a sharp instrument used for making incisions. Both tools are essential in their respective fields, and recognizing their appearance and uses is important for clinical practice. Here's a close-up of the surgical blade. This instrument is designed for precision and control during surgical procedures. The blade is typically made of stainless steel and comes in various shapes and sizes to suit different surgical needs. Proper handling and disposal of surgical blades are essential for safety and infection control. This image shows the setup for peritoneal dialysis, procedure used to remove waste products and excess fluid from the blood when the kidneys are not functioning properly. The process involves infusing a dialysis solution into the abdominal cavity, where it absorbs waste before being drained. Recognizing the equipment and understanding the procedure are important for those involved in renal care. This image demonstrates the position given to patients in shock, known as the Trendelenburg position. The patient is laid flat on their back with the legs elevated higher than the head. This position helps improve blood flow to vital organs during shock. Recognizing and applying this position can be life-saving in emergency situations. Here's another view of the shock position. This position is used in various emergency scenarios to enhance venous return and support circulation. It's important to know when and how to use this position, as it may not be suitable for all patients, such as those with certain head injuries or respiratory distress. This image features an infusion pump and a syringe pump, both used to deliver fluids and medications with precision. Infusion pumps are commonly used in hospitals for continuous drug delivery, while syringe pumps are ideal for small volumes and precise dosing. Understanding the differences and applications of these devices is essential for safe medication administration. Here's a close-up of the infusion pump. This device allows for precise control of fluid and medication delivery, reducing the risk of errors and ensuring optimal patient care. Infusion pumps are programmable and can be set to deliver specific volumes over a set period, making them invaluable in critical care and anesthesia. This image provides a detailed view of the syringe pump. Syringe pumps are used for delivering small, precise doses of medication, often in neonatal or intensive care settings. Their accuracy and reliability make them essential for administering potent drugs that require careful titration. This image shows a central line and a peripherally inserted central catheter PICC line. Both are used for long-term intravenous access, allowing for the administration of medications, fluids, and nutrition. Central lines are placed in large veins, often in the neck or chest, while PICC lines are inserted through the arm. Recognizing these lines and their indications is crucial for safe patient care. Here's a closer look at the PICC line. This device is inserted into a peripheral vein and advanced to a central vein, providing reliable access for extended therapy. PICC lines are less invasive than traditional central lines and are commonly used in outpatient and home care settings. This image features an oxygen hood and an oxygen tent, both used to deliver supplemental oxygen to patients, especially infants and children. The oxygen hood fits over the head while the tent encloses the entire body or upper torso. These devices provide a controlled oxygen environment, essential for patients with respiratory distress. This image demonstrates the Celix maneuver, also known as cricoid pressure, used during intubation to prevent aspiration. The Heimlich maneuver, on the other hand, is used to relieve airway obstruction caused by foreign bodies. Both techniques are vital in emergency airway management and require proper training for effective use. This image displays electrocardiogram (ECG), tracings of ventricular tachycardia (VT) and ventricular fibrillation (VF). These are life-threatening cardiac arrhythmias that require immediate intervention. VT is characterized by rapid, regular heartbeats, while VF presents as chaotic, irregular electrical activity. Recognizing these patterns is crucial for timely and effective resuscitation. This ECG image shows atrial fibrillation and atrial flutter, two common arrhythmias. Atrial fibrillation is marked by irregular, rapid heartbeats, while atrial flutter has a characteristic sawtooth pattern. Both conditions increase the risk of stroke and require careful management. Recognizing these ECG patterns is a key skill for healthcare providers. This image illustrates varicose veins and Caput-Meduse, both of which are signs of underlying vascular or liver disease. Varicose veins are enlarged, twisted veins usually seen in the legs, while Caput-Meduse refers to distended veins around the umbilicus, often due to portal hypertension. Recognizing these signs can aid in the diagnosis of systemic conditions. Here's a closer look at Caput-Meduse. This condition is characterized by prominent, radiating veins around the navel, often associated with liver cirrhosis and portal hypertension. Recognizing this physical sign is important for identifying serious underlying health issues. This image shows a cat's paw retractor and a nasal retractor, both used in surgical procedures to hold tissues apart and provide better visibility. The cat's paw retractor has a distinctive claw-like end, while the nasal retractor is designed for use in nasal surgeries. Proper identification and use of these retractors are essential for successful surgical outcomes.